Well, welcome to Boomers Today. I'm your host, Frank Sampson. Of course, each week we bring you important and extremely useful information on issues facing baby boomers, their parents, and other loved ones. And I just want to thank everybody for all their support. So many of you have shared our podcast with family and friends, and that's how we've grown. Many of you listen to us on your favorite podcast station, whether it be Apple Podcasts, Google Podcasts, iHeartRadio, Spreaker, Stitcher, all those various ones, or some of you have gone to our website at boomerstodayradio.com. So I want to thank you all for doing that. And I know that our listeners are growing each and every day because we bring you wonderful guests and make it very educational. Today's not going to be any different. We have with us Dr. Amanda Leggett. Dr. Leggett, did I pronounce that last name correctly? I should have
You
asked you
did
before.
perfectly.
Okay, great. And she is an assistant professor in the Institute of Gerontology and Department of Psychology at Wayne State University, actually my hometown in Detroit, Michigan, and adjunct assistant professor in the Department of Psychiatry at the University of Michigan. She received her MS and PhD in Human Development and Family Studies from Penn State and is a fellow of the Gerontological Society of America. Her research program focuses on the dementia caregiver stress process and mental health in late life. Dr. Leggett serves on the editorial board for the journals Innovation and Aging and Research on Aging and is a 7-year hospice volunteer. Dr. Leggett, thank you so much for joining us on Boomers Today. Really appreciate it.
Thank you so much for having me. It's a pleasure to be here.
Yeah, I mean, I love we don't get have researchers on our show too often. We have in the past on on dementia and various forms of dementia like Alzheimer's, but I have to say, probably our first one, first person we've ever had on the show who does research on caregiving. So it's fascinating to me, and maybe we could just start. Maybe you could tell us kind of how you got interest in the field of gerontology and caregiving, and what kind of led you into this research.
Yes, definitely. Well, I'm honored to be the first caregiving research that you all are including, so thank you. So, really, the story of how I got interested in this area goes back to high school when I got my first job outside of babysitting. And I worked as a waitress in an assisted living facility down in Alabama. And I learned really quickly that I didn't like the food services aspect of the job, but I really loved working with the residents, hearing their stories, learning more about them. But it was also a very eye opening experience for me as a high schooler to see just the variety of challenges that were in that setting, particularly mental health wise, whether it be depression or anxiety or ongoing, memory problems. And so it really was opening my eyes to the world of gerontology because all of these challenges can just be really prevalent in long-term care facilities. And so I went to college interested in the study of aging and majored in psychology. And really, where caregiving came about was the fact that I also loved working with other age groups. So as a college student, I worked with my church's youth group for several years. Like I said, I really did a lot of babysitting growing up and always loved working with children, but really felt this calling towards older adults and the challenges that come with aging. And so, how I landed on caregiving was really in graduate school with my advisor, Dr. Stephen Zarrett, who is really a pioneer in the field of caregiving. I was able to kind of see how I could study intergenerational issues that relate to aging by thinking about caregiving because often, a caregiver is a spouse who may also be an older adult. But just as likely, we see adult children, we see increasingly grandchildren who are providing care for a grandparent with a dementia. We'll see friends, neighbors, daughters in law, sons in law, nieces and nephews. There's a whole variety of family members and friends who are now stepping up to take on this care partner role. And so it really helped me think about mental health and issues of aging like dementia, but from somewhat of an intergenerational perspective. So that's really how I landed there.
Yeah, so that's you call. We talked a little bit before coming on the air, and a term that I hadn't heard before. I mean, caregiving styles research.
Hmm.
So, is there a style of a caregiver that's better than another, or tell us a little bit more about that term?
Yes, definitely. So, caregiving style is an area of research that we've been working on for about 5 years now, and it's still ongoing. So, the work is never complete in the field of research. But this came about from just the recognition that caregivers approach care differently from one another. Just like we were talking before, parents, you probably have, if you're not a parent, listeners, you've had a parent, right? And so you've probably recognized over the years how parents approach care for children differently. And there was really some seminal work done in the field of psychology decades ago, really starting in the 1970s, I believe, looking at different styles of parenting and how that relates to child outcomes like school performance, socio-emotional well-being, and so forth. And so, in my work, we're doing something very similar where we're really trying to better understand the variability in ways that family members and friends provide care for individuals with dementia. So, both in the ways that caregivers are thinking about care, how well do they understand dementia and its symptoms, how adaptable are they, and then also the ways that they behaviorally approach care. Like, are there different strategies that some caregivers use more than others? And so, for the past 5 years, I've been doing research where we did in-depth interviews with caregivers, both using quantitative scales where our caregivers are answering like on a scale of 1 to 5, but then also really open-ended interviews where caregivers are sharing with us their stories about what they find challenging in caregiving and when something stressful happens, how do they approach it? And they really walk us through start to finish what the challenge was, how they approached it, how they responded, what were they thinking, what were they saying, what were they doing. And so, from exploring both responses to these in depth interviews and also quantitative scales, we've been able to develop about 5 profiles, distinct profiles of these caregiving styles. And you ask, if one style is better than another. And so, I'd say it's kind of a tricky question because we generally, in the work that we're doing, try to avoid talking about a better caregiving style or a worse caregiving style because the reality that we find is that each style has strengths and each style has rooms for growth or areas where they could improve in certain ways. However, we do see that there are certain styles that are more likely to be associated with some negative outcomes, like increased stress for caregivers. We've even collected saliva samples in our research and are even able to identify distinctions in physiological stress by looking at cortisol and also well-being, so quality of life of the individual with dementia. We do see some distinctions between these profiles on these different outcomes, but like I said, there's really not a best style or a worst style. These styles just reflect different ways that caregivers approach care, and given what we're seeing with these distinctions and outcomes, our interest is really being able to work with caregivers given these unique styles and see if we can better target and tailor our approaches to working with them, our services that we're recommending to caregivers, interventions. They just might be tailored differently to someone's style that can help them approach care in a way that's going to be more beneficial for them and for their care partner.
Yeah. I mean, I mentioned to you that I and my organization were involved in the senior care industry, and we're always very, very concerned about the caregiver's well-being themselves,
Mhm.
and many times the person that is being cared for outlives the caregiver. Have you
Mhm.
seen that in your research, and can you expound upon that at all, and how important it is for the caregiver to take care of themselves?
Oh, definitely. I mean, we see it so much. I mean, I think one of the most common phrases that we say to our caregivers is that you can't pour from an empty cup. So you can't be helping someone else if you're not also caring for yourself. What is interesting, though, I think early on in the field of caregiving research, there was so much focus on stress and the negative aspects of caregiving that are certainly associated with providing care. But I think increasingly there's more focus on the resilience of caregivers and some of the positive aspects of caregiving, ways that caregivers grow and even thrive in their role. And some work that myself and some of my colleagues did a few years ago, actually looking at a large scale nationally representative data set, we looked at caregiving and mortality. And we actually found that caregivers and even dementia caregivers were having reduced risk of mortality. So, I 100% have seen what you mentioned, and it's not. I don't want to say it never happens. It does happen where sometimes the caregiving role can be so burdensome or stressful for someone, and you do see that person, facing a lot of stress or even passing first. But generally, kind of on a national level, we actually see that caregiving can have a lot of benefits, even reducing risk for mortality. So I think of it in a way similar to some research that's been done on volunteering and the health benefits of volunteering, because volunteers are active, they're up and moving, they're doing something that's giving back to others that may enhance well-being. So you can kind of think of caregiving similarly to that, and in some ways we see it as having health promotional benefits, and that in some sense caregivers are doing better than others. They need to maintain their health to be able to continue providing care. But I think my concern as a researcher is exactly what you said, that we definitely do see elevated rates of stress, elevated rates of depression, anxiety, sometimes sleep problems in caregivers relative to their same age peers. And given that, a lot of the focus in our field is been on how can we reduce those negative outcomes through intervention, services, programs, et cetera. And so that's definitely one of the goals of my work, because recently, in the past couple of years, there was an influential report that went out from AHRQ, Agency of Healthcare Research and Quality, that did a kind of a review of caregiver interventions and services. And while the review found that they did have positive effects, it was kind of underwhelming. I think generally when the field saw that report come out, people were disappointed that these past decades of research on caregiving interventions didn't have as big of an impact as everyone had hoped. And so now I think the challenge is, how do we get that impact? So how do we take the interventions that have been developed and have them help caregivers more? And so that's where I think this concept of caregiver style comes in, is that, there's a variety of reasons why we may not be seeing as positive effects as we would like. One may be, maybe it's the caregivers that are doing really well, that have time to spare, that are signing up to be in research studies, right? So
Right,
if they're
right.
already doing well, you may not be seeing as much of a positive improvement because they don't have as much room to improve. Or maybe, the way the intervention or service program is just not meeting the right need of the caregiver at the right time. And so by having a better understanding of caregivers' current styles of care, how they're approaching care currently, my goal is that we can take some of these existing programs and services and better match caregivers with the right program for them at the right time, or take a program and just tailor it to the given needs of a caregiver style. And maybe then we'll start seeing some more significant effects than a lot of these one-size-fits-all programs that have been coming out for a while.
Great. Very interesting. We're going to take a real quick break, I promise. All right. And when we come back,
Sounds great.
I love to talk more about kind of what you know so far as the outcomes of the various caregiving styles of individuals who are, helping people with the dementia and et cetera. So I'd like to talk about that. But we're going to take a
Sounds
real
great.
quick break just to recognize our sponsor. So, do you know anybody who may be concerned about an older driver? Well, Senior Care Authority's Beyond Driving with Dignity program is a facilitated self-assessment program for older drivers. This program has been designed to serve as a vital tool to facilitate older drivers and their families as they make appropriate decisions regarding the future of one's safe driving career. If the individual is a safe driver, an advisor will provide him or her with strategies on how to remain a safe driver as they progress through the aging process. If driving retirement is the appropriate decision, then the individual and their family are offered possible alternatives, resources, and a specific plan to ensure a smooth and successful transition from the driver's seat to the passenger seat. To learn more, you could go to www.beyonddrivingwithdignity.com, or you can call 877-907-8841 to connect with a Senior Care Authority advisor in your area. We're back with Dr. Amanda Leggett, who's an assistant professor in the Institute of Gerontology and Department of Psychiatry at Wayne State University in Detroit, Michigan. And we're thrilled to have her on. She's done quite a bit of research on caregiving and caregiving styles. So Dr. Leggett, tell us more about, before we do that, I wanted to maybe if you may be looking for caregivers, maybe adult children or spouses that are caregiving with someone with dementia. Is there somewhere that if they are interested in participating in any research or anything like that you'd like to share with our listeners?
Definitely. Yeah. Thanks for letting me share. So I would encourage you all, if interested in this work, to look up our Institute of Gerontology at Wayne State. If you just search Institute of Gerontology, Wayne State, you'll find our website. You will find my faculty profile that has my email. We're always doing research where we're looking for caregivers. And in fact, I have a study coming up that'll be starting next month where we'll be recruiting caregivers to actually develop a measure of these caregiving styles to help us be able to come up with like a 20-item measure that can help identify someone's style succinctly that could be used by caregivers themselves, clinicians, community service agencies, etc. So would love for you to reach out if you have interest in participating in this work. And also our Institute of Gerontology at Wayne State always has a variety of continuing education programs that we're doing, or free conferences for caregivers to learn more. We have one coming up, I believe, also next month, and all of that information will be on our website. So I'd be happy to connect with any of you more if you'd be interested in learning more about this work.
Great. That's wonderful. Thank you for that. So how are various caregiving styles associated with the outcomes for individuals living with dementia, and their care partners?
Yeah, definitely. Maybe it'll help if I first kind of share what some of these styles look like, and
That'd
I
be
can
great.
kind of talk about the outcomes that we're seeing. So, as I said, we have identified 5 distinct styles through these in-depth interviews that we've done. And they vary in terms of both their cognitive or thought processing approaches towards caregiving and dementia, and also behaviorally in the ways that they're managing care. And so our first style we call the externalizer. We've given each one a name. And externalizers tend to have a more superficial understanding of dementia. What I mean by that is they maybe don't recognize the symptoms of dementia as stemming from a disease. They view them as more volitional or intentional, as targeted towards the caregivers themselves. And the ways that they approach care tend to be more rigid, less flexible. They often feel anger, frustration, some helplessness in their care. And this is a style that we do see associated with some of the more negative care outcomes. As I mentioned before, we collected some saliva samples, and this is our style of caregiver that tends to show elevated cortisol profiles, which reflect more elevated physiological stress. So, what's really fascinating about that is it's one thing for a caregiver to say that they feel stressed. It's another thing for us to be able to demonstrate that the body is suggesting elevated stress, which is exactly what we're seeing with this group. And so, I'm hopeful that this is powerful data to take to politicians to, show that we need enhanced, funding and resources for certain caregivers who are really encountering very stressful caregiving situations. Next, we have what we call the individualist. For a while, I called this the Just Do It group, kind of like the Nike slogan, because that's a phrase they would tell me again and again, and we just do it. And so they're a little bit of a lone wolf in the sense that they tend to take most all of care responsibilities on their own shoulders and just find it easier to manage that way if they do things. And so they take a pretty straightforward approach to care. They don't have a lot of adaptive behavioral strategies that they are using when challenges come up. They're just kind of taking care of things themselves. But they're taking care of things without encountering too many roadblocks. So sometimes this is a caregiver that's at a little bit of an earlier stage of dementia where they're able to manage that way by kind of independently handling things. And so we do see that they show increased stress in some areas, like taking care of functional tasks of care, like those basic activities of daily living. But generally, we don't see them as being the most highly stressed like we see with the externalizer group. They're very diligent note takers. So some of the clinicians that work with us say that they see this style of caregiver in the clinic with, a detailed sleep schedule and activity schedule. And so I kind of tend to think of this group as a little bit of like the male engineer type that is really meticulous and getting things done. But at some point in care, I think all caregivers realize that they just can't do everything themselves. And so, we want to make sure that the resources are there for this particular group when they do start to hit a wall in their care. Middle of the groups, like number 3 of the 5 is we call the learner. And the learner is a group that's kind of currently struggling. They're facing a lot of challenges and trialing and erroring a lot to figure out how to better manage care. And they're growing in how they understand dementia and how they respond to it. But when challenges come up, they aren't having adaptive solutions at their fingertips to address those challenges. So they're kind of in the middle in terms of care outcomes that we see. They're not the most stressed, but they're also not the groups reporting the most favorable outcomes either. The reason we're excited about this group in particular is they recognize that they need to change their approach. So in the interviews we're doing with them, these caregivers are telling us, I realize that the strategy I'm using isn't working for me, but I don't really know what to do to resolve this problem. And so we really feel like this is a group that will thrive in a lot of behavioral interventions for caregivers that have been developed because they're ready and willing to learn. They recognize, a need to change their approach. They just don't necessarily have the toolkit at their disposal to use. Next, we have the adapters, and kind of in contrast, the adapters have like a huge tool chest at their disposal. And they talk a lot about how they've learned over the process of providing care. So, for example, it used to be that they did one thing, but that didn't work. And so now they recognize that this approach works better for them. So this tends to be a profile that's been providing care for a longer period of time. So they maybe started out in a different style, but over time they became more adaptive and more flexible in their caregiving approach. So they have a solid understanding of dementia. They're very flexible. If one thing doesn't work for them, they can easily navigate to a new caregiving approach. But like emotionally, we see this group doesn't bring a ton of emotion into their role. Similar to an individualist, they kind of get things done without bringing too much into it. And then finally, our last group we call the nurturer. And the nurturer is a group that is very other focused in the sense that they're focusing less on the stress of care to themselves and more on the stress of caregiving challenges to the individual living with dementia. They use a very comfort-based approach. They approach care as a team. They talk about how, myself and my care partner, we do things together. We figure it out as a team. And then they'll use kind of some unique approaches in their care in addition to teamwork. For example, I love this example. Actually, adapters use this too. We saw where, if they're in a grocery store and the individual with dementia, starts to get agitated, rather than an approach of getting stressed or concerned about, what are we going to do? My partner's getting agitated. They'll just say, like, hey, I'm not feeling well. Let's go sit in the car for a while. So they put they put it on themselves rather than the individual with dementia kind of disperse that responsibility in the moment. And
they know how to divert it.
Exactly. They know how to divert. Exactly.
Yeah, right.
So we see that this nurturer style tends to have the most positive outcomes. So we see they report the least amount of stress. They also report the highest quality of life of individuals living with dementia. So they contrast probably the most with the externalizer group in terms of their outcomes, where the other three profiles that I mentioned are a little bit more in the middle. So not doing the best, not doing the worst, kind of they're in the middle in terms of where they fare.
Right. Very interesting. So would you know, as far as the various caregiving styles that you just went over, those that have taken the time to educate themselves on dementia and how to deal? You brought a perfect example up in the grocery store, all right? But
Right.
we could probably come up with a lot of different examples like that. But somebody who
Oh, yeah, exactly.
has educated themselves versus they just kind of dove in not knowing anything and they've kind of learned the hard way. What's your experience in the research you've done there?
Yeah, definitely. I mean, it's hard because no one expects dementia. It shows up at our door. It's not like you can take a test really at age 20 and know that this is coming, right?
Right,
And
exactly.
so to some level, all caregivers are jumping in, feet first without really background training. We do see, for example, in the nurturer style, some of the caregivers that were reflected in that style had been nurses, for example, or had been in other caring professions where maybe, caregiving came a little bit more naturally to them based on their background professionally. But, the reality is, I think most all of these caregivers are kind of the diagnosis comes and you're jumping in. Granted,
Right.
with dementia, it's something that, there's a slow decline in many cases over a period of years. So it's something you figure out a lot as you go. But certainly, education can help tremendously. some of these behavioral interventions where you're learning different behavioral approaches you can use to manage these challenges can help tremendously. But it really depends on the caregiver and what they're facing at the time and where they are, what's going to be most beneficial. So, for example, reading a book on dementia for an externalizer may not be as meaningful as really being able to kind of step into the shoes of that individual and really gain better understanding of what they're experiencing and what they're going through. Being at a university and previously I was in the medical school, one exercise that's often used with med students, for example, is, giving them these glasses that, make their
Right. Yeah.
vision
I've
appear
done that.
differently.
Yeah, it's pretty amazing.
Right. Yeah.
Yeah.
These simulations of trying to understand what it may feel or be like to be an older adult. And so in some sense, that's some of this like experiential learning almost that I think could be beneficial for some styles. And then, for the learner, when you think about the learner that I mentioned, they may really thrive in a support group where they're surrounded by other caregivers and they can problem solve and troubleshoot together because they're at a place where they're ready to learn and they're ready to experiment. Whereas some of our styles just aren't there yet. And that's okay. I think there's something that can be beneficial for each caregiver at a given place and time, but it can certainly be hard because, the famous book on caregiving is called The 36-Hour Day, right?
Right.
Like the
Right.
caregiving responsibilities can be so time consuming. And so finding the time to educate yourself and to participate in these programs can be really challenging for people. But any little thing you can do to learn and grow in your understanding, I do believe is helpful.
I could talk to you all day on this subject
Oh,
matter.
yeah.
I think it's fascinating what you're doing, and I really appreciate everything you do. So maybe we could just end it with. We have to try to be quick on this one from a time
Sure.
standpoint, but just any advice that you could give to either clinicians or those in our industry that are providing, guidance to families and caregivers and how they may want to tailor their approaches to caregivers of these different styles. I know that's a tough question to answer quickly, but any quick overview that
Yeah.
you could provide?
Yeah. And I mean, this research is ongoing. So stay tuned because I hope I'll have even better answers to this question and moving forward. But we did do a variety of interviews in our research with clinicians, social workers, nurses, geriatric psychiatrists, etc., on when they work with caregivers, do they approach caregivers differently based on their working with them in the clinic space, etc. And we do find that a lot of clinicians kind of naturally do this. In the research we're doing, we're hoping to have better evidence and kind of be able to provide empirical data on this exactly. But we do. I mean, I would say, caregivers find or clinicians find that for caregivers who maybe don't have as strong of an understanding, analogies can work really well. Like the pipes are corroding, as an example of an analogy a clinician might use to a caregiver that's just not getting it. Like it's
Right.
not the individual with dementia trying to frustrate you or intentionally forgetting what you're saying. There's a disease process taking place. So using some of these analogies with certain caregivers can be really helpful to make it click, what's going on here. For other caregivers who are at the place where they're just needing some additional support and how they manage all of these responsibilities, I mean, there's a variety of programs out there, interventions out there to connect caregivers to help them, and making notes of what's going on and what have they tried and what can they try next to see what's going to work best. So really working with them in this troubleshooting trial and error process can be helpful. And then for some of our caregivers who are just doing really well and really thriving in the role, I would, encourage them to maybe join a support group and offer your wisdom to someone else or, peer mentoring programs where they can walk alongside someone else that's struggling. I think we see it so beneficial, not just for me as a researcher to come in and say, here's what you can do, but someone who's actually lived this caregiving experience can be such a support to someone else. So, that's me being very short. I think I have a lot more thoughts on that question. And like I said, the research is ongoing that we're doing here and trying to better understand how we can tailor and target. But I would say don't just look at caregivers as one size fits all. Each caregiver is an individual. Each case of dementia is unique. And
Right,
so
absolutely.
my
Right.
biggest point of advice is to look at these individuals as exactly that, individuals, and how can you best personalize your approach to working with that individual given the challenges they're currently facing.
Yeah. Well, I hope you'll come back on this show in the future after more research is done, because it's just extremely enlightening and educational, and I truly appreciate you taking the time to join us today.
Definitely. My
Yeah,
pleasure. Thanks so much
yeah,
for having me.
yeah. Well, thank you for joining us, and I want to thank everybody for joining us as well. Please be safe out there, and we'll talk to everybody next week.